Okay, so hi, my name's Kathryn Greenwood. I'm a clinical and research psychologist. I'm based at Sussex University and Sussex Partnership NHS Foundation Trust. So I'm going to talk to you today about the EYE project and the EYE-2 project. So that stands for Early Youth Engagement in First Episode Psychosis Services. So this involved services across the UK, so the north and south of England, urban and rural areas in Manchester, in London, in East Anglia, Hampshire and Thames Valley. Okay, so the novel EYE-2 engagement model is a motivational engagement approach. It's actually delivered by the whole team, but with a particular focus on the key worker. And the focus is on the key worker being really motivational, considering and paying close attention to the young person's goals and putting that at the centre. Alongside this is a systemic approach, so this brings in friends and family, again to support the young person with their goals, and a substantial psychoeducational component, again using myth-busting booklets and a website to support the young person to move forward. So, having got all of our resources and our approach ready, the next stage was to test this intervention. So we wanted to know, is it helpful? Does it make a difference in terms of cost? And are people able to implement it? Okay, so in terms of findings, we randomised 20 early intervention services, and that included 1,027 young people experiencing a first episode of psychosis. So in terms of the findings, this is the largest real-world whole population study of young people in early intervention services that's ever been conducted. We didn't exclude anybody, so everyone who came into the service between May 2019 and July 2020 was in the study. And that's really important because that means that we can really reasonably generalise to day-to-day early intervention services around the UK. So in terms of our findings, the first thing that we found was really actually quite low disengagement rates. So only about 16% of young people disengaged from services, and that was actually the same in early intervention as standard and in the EYE-2 approach. The second thing we found was that mental health outcomes and recovery outcomes were more positive. Things improved over the year. And again, that was the same in the early intervention and the EYE-2 approach. So no added benefit for EYE-2. However, as I'm sure you remember, we also had a global pandemic which came along in the middle of the study and undoubtedly impacted on how everybody engaged with early intervention services. And we also had the NHS England, who were working very closely all throughout this time with NHS services to improve early intervention services. So again, that may have made some difference. What we did find was firstly cost savings in terms of particularly inpatient admissions. So a £1,200 per person saving in the early youth engagement intervention in terms of inpatient admissions. So young people spent slightly less time in hospital in the EYE-2 approach, and that's valuable because young people don't want to be in hospital, the families don't want to be in hospital. Okay, so the second thing we found that was important was that in a subgroup of people who received the EYE intervention, so we saw 6 weeks more time spent in education and training over 12 months for people who received the EYE intervention compared to those who didn't. And on top of that, they also showed more time in stable accommodation and more time in employment. However, we do need to be a little bit cautious of these findings because this was a subgroup of 232 people who also completed a questionnaire at 12 months. Okay, so overall, the EYE-2 approach is a really low-cost therapeutic engagement model. It's easy to implement and it's really positively received by young people, their families and staff. What we should be thinking about going forward is how to target even further groups of people who are at greatest risk of disengagement, so people who don't engage well from the outset, and also people for whom social and occupational outcomes are important goals. And the last thing that we noticed was that around 11% of young people seem to become unwell and then move across the country, often returning home. So we might want to consider how to better support young people when they're more perhaps socially and geographically isolated from their families.